And as we celebrate Women's Day, we wanted to bring back Kristy Smorol from the American Heart Association. Kristy, thanks for coming back.
Of course, thanks for having me.
We want to put the focus on women's health today. You know, so many of us women are caretakers. We're so busy taking care of everyone else, the children, sometimes even our own parents. Our own health sometimes gets neglected. Why is it so important to put the spotlight on women's health today?
Unfortunately, what you're saying is exactly right. We are caretakers and we put everyone else first, and combine that with the fact that sometimes our symptoms are harder to spot than what we might expect. And so it's easy to say, I just don't feel good today, but I'm too busy. I'll take care of it tomorrow. But that may be a health emergency. For women, heart attack symptoms are sometimes the less common things. You know, when you think about that, an elderly man who clutches his chest and falls over, but that's not necessarily a heart attack for women. We might be dizzy, lightheaded, nauseous. We might have neck, shoulder, jaw, back pain. Again, all things where it's easy to say, I'll take care of it tomorrow. But it could be a heart attack.
And what are some of the important symptoms women really need to pay attention to, if you can expand upon that?
Absolutely. The chest pain and pressure, it feels like an elephant sitting on your chest. That is still the most common symptom. But I've worked with heart attack survivors who say they really just start to feel like they have the flu, and that has been a heart attack for them. We might have more things like the cold sweats and indigestion and heartburn, all these things that maybe, you know, are not going away, or you don't feel right. You need to pay attention to really anything, head, chest, stomach, all of that area. There are symptoms that could be heart attack symptoms.
And Kristy, this is a great opportunity for women to learn more, even right here at the fair.
We have information anywhere you want to get it. You know, you can find tons of stuff online at goredforwomen.org. But here at the fair for Women's Day, really take a moment to think about what Women's Day means and think about our health.
Right. And what are you hearing from women today at the fair? Are you surprised at how they may not be that aware of some of what you've been talking about?
Unfortunately, a lot of people say, wow, I had no idea heart disease is women's #1 killer.
Wow.
And that is a really important statistic to remember, because we think that heart disease is just a man's disease, but it's really not. It is our #1 killer, and that's a surprise to a lot of women.
#1 killer, and now you know, so we can all do something about it. Kristy Smorol, American Heart Association, thank you so much for joining us. A round of applause, because what you do is so important.
Thank you very much.
We've got more live coverage from the fair. When we come back, we're going to take a look back at some vendors who've been here for a long time. You'll enjoy that segment.